On March 23rd of 2010, the Affordable Care Act became a law. Here to tell us how this is shaping the practice of medicine and how it could affect you is patient advocate Dr. Mitchell Brooks. Thank you for being here, Dr. Brooks.
Good morning, Ashley. How are you?
I'm great. I'm glad you can join us and talk about this very relevant topic that many people just are probably kind of in the dark about. You are very knowledgeable on this subject, been a orthopedic surgeon for a while, but you've been on the other side too. You had a heart transplant, so you just know the ins and outs of this. And tell us, where you think the practice of medicine is going as of right now with this whole healthcare reform.
Well, I think really that will all depend on what happens on January 1st.
2012.
The upcoming year.
Mm-hmm.
And at that time, the new law will come into effect that reduces the Medicare prices by 29%. So fees to physicians will be reduced by 29%. And since other insurance contracts are negotiated based on 100% of Medicare plus a certain percentage, then those contracts are also going to decrease. What's going to happen is that the physician just can't afford to see the Medicare or the Medicaid patient. It will cost more to see that patient than the patient or the physician will get back. So they'll be forced to not see those patients. And you're seeing it now. A lot of patients come to me, they're concerned. I take no insurance in my practice, but I advocate for my patients. I take care of them. And I tell them, look, this is just the way it's going to happen. It's a simple matter of dollars and cents. It's not an issue of social justice or anything like that. Otherwise, people will really have to close their doors. So the issue is, well, will this happen? Will it won't happen? My guess is it's going to happen to a certain extent, and it has to happen to a large extent because the debt that we've incurred in health care and the unfunded debt is huge. And unless the Obama administration takes those steps, there may be a run on the U.S. dollar and on the credit rating of the U.S. dollar, since health care is the largest portion of our unfunded national debt. So what will happen is that if the physicians don't continue to see Medicare and Medicaid patients, you're talking about a huge group of people, and they're all voters. And the politicians are going to be forced to legislate physicians to see Medicare and Medicaid. And my guess is that will happen. It's present in several states right now. So what will then happen is, in my view, the physicians will split. You'll have a group of physicians who will not accept any insurance, and they'll see their quota of Medicare in a similar manner that American Airlines allocates its seats for Vantage miles. And the other subset of physicians, which will be larger in number, will accept the current insurance that they have, and eventually, I believe, will evolve into a single payer, because the law, in my view, is set up to push everybody towards a single payer. And that's what's going to happen. And so
what could this mean for employers, and then on the flip side, people who are either have no insurance or have private insurance at this point in time? And going along with that, give us some advice for those people.
Well, let's start with the patient first, because the patient's the most important thing for me. People will have to, if they can see a physician that does not accept insurance, if it's a specialist, if it's something that occurs every 4 or 5 years, then they'll be able to do that. And there are vehicles that are available to them to do that in the insurance industry today, but I want to just hold off on that for a second. Employers are going to be forced to basically say, I'll just pay the fine or the penalty and let everybody go into the pool with everybody else. The bottom line is that you've added 30 or 40 million people to the entire pool of patients. You haven't increased the number of physicians, and you're going to have a subset of physicians who are not going to see Medicare and Medicaid. You got baby boomers coming into the mix. So what's going to happen is the waits are going to be huge. They're going to be long, and it's going to be very difficult to see a doctor. If indeed you get to see a doctor, you'll see likely a physician extender. a nurse practitioner, a physician's assistant. So that's what's going to happen. And the McKinsey Group has already done a study, and 33% of the employers have said that they're just going to give it a miss, and they're going to go right into the national health plan that has been promulgated by the president and is now law. They'll pay the penalties, and everybody gets into the pool.
Dr. Brooks, lots of great information. Certainly you're a great resource for this, and I want to thank you for being here and talking on this subject matter today. And of course, if you have any questions that you would like to ask Dr. Brooks concerning the new healthcare law, visit mitchellbrooksmd.com and click on the Advocates Avenue tab at the top of the page.